If sepsis confuses the bejesus out of you, then stick around for 3 minutes. I'm gonna explain it in a super easy way to help you understand. All right, so sepsis is basically when your body is an absolute drama queen and it overreacts to an infection in your body, causing massive vasodilation, all right? That's the basis of it. So let's talk about what happens. So inside your cells or somewhere in your body, something says, something is wrong. And when something is wrong, your whole body goes into panic mode and it's gonna bring out inflammation and white blood cells and platelets. Kind of like if your friend called you, bestie, calls you up and is like, oh my God, something's wrong. And then they hang up and you're like, you're going to go over there. You're going to go over there as fast as you can and get to them, but you don't know what's wrong. So you have to bring everything with you. So what if their boyfriend just broke up with them? You know, you're going to bring chocolates and wine and tissues. Or what if, you know, someone's trying to break into their house? You're going to bring a weapon. Like, we don't know. So your body overreacts and is like, oh my God, I'm on my way. And so it starts going through the blood here, but it notices that there's some traffic, right? And so when there's traffic, it's like, oh my God, I have to get to my friend because something is wrong. And so it will vasodilate or open up the road so that it can get to the problem faster. So step 1 of sepsis is your friend says something is wrong. Step 2, there's traffic. So I'm going to vasodilate and open up these vessels very wide so that my car can easily get to my friend. But when our vessels open, we get massive hypotension because the bigger the vessels open, the lower the pressure. So that's going to cause hypotension in the body. So in a patient with sepsis, their blood pressure is going to be like 2/1. Okay, not really. It'll be like 90/60 or something. Okay, but their blood pressure is going to drop. Well, that's a problem because all this blood is dumping here and into the third space here. All right, so we are going to increase their capillary permeability. Means not only are we going to widen the road so I can get there fast, I'm going to widen this road too. So all the fluid that was in the blood is now going to dump out into this space. All right, which is going to leave us with third space fluid. So no matter how much fluid I'm dumping into my sepsis patient, and leaking out into the third space because everything is widened. I'm trying to get to them. I have widened this, and so all of the fluid is going to be dumping out into here. So that's the problem with sepsis is the vasodilation is so intense. We were so dramatic because of this infection that now there's not enough blood and perfusion inside the vessels to get to my organs and to get to my tissues and to get to my cells. So the patients will start crashing on you. All right, so let's talk about what happens when you go into sepsis. So we have a massive infection, a systemic inflammatory response. Your whole body says something is wrong. So what do I see early? This is when I am running to my friend. All right. So the temperature is going to be kind of erratic, right? You're sweating and then you're cold and then you're, okay? And the heart rate and the respiratory rate are going to go up because I'm compensating and I'm trying to get to my friend. And I'm trying to, oh my God, I'm freaking out because she needs me and I'm not there, okay? We may see some mental status changes because the body, remember, huge overreaction. Late signs is when your car done stopped, okay? Because it got tired, it could not get to you, the blood pressure is going to tank, the pulses become weak, and then you got here your kidneys, who are your ride or dies, all right? The kidneys are one of the only organs that can die and come back. So the kidney says, hey, you don't have enough blood and perfusion to get to your tissues and your organs, so I'm going to take the hit. You can take the blood that you normally would give to me, and you can give to other organs. So this patient in sepsis and septic shock, that is what we see in septic shock, is their kidneys will start to fail because they took the hit. They said, I'm your ride or die, and you can take the blood you were going to give to me and give to somebody else. The kidneys will start to fail. They'll go into an AKI. All right. The blood test for sepsis is lactate. So if it is greater than 2, we're going to recheck, telling me like, it's not going good. If lactate is greater than 4, that is sepsis, and we're going into full out septic protocol. What does this patient need? I need a culture to find out what is wrong, what is causing my body to panic, what infection is causing it, okay? I'm going to give them massive IV fluids because remember, all our blood is dumping into the third space and they need fluids because their blood pressure is going to be low. And they need massive antibiotics because the origin of sepsis was vasodilation due to a massive infection, yes? So in septic shock, and people get confused about this, it doesn't mean your body's like, what? Shock? I'm so shocked. That's not what it means. It means that your kidneys have taken the hit. The kidneys are starting to pull perfusion away from them and giving them to other places, and all your other organs will start to do that too. So as your BP starts to drop, your kidneys start to die, and then we go into MODS, multi-organ dysfunction syndrome, where your other organs will also start to take a hit. There's not enough perfusion, there's not enough blood flow, and the other organs start to die. And this is what happens with septic shock, as the organs start to die, and then so does the patient. Does sepsis make sense now?